Arm anatomy made easy. Bones, muscles, blood vessels and nerves explained. Welcome to this detailed guide on the anatomy of the human arm. The arm is one of the most versatile and important parts of the human body. Every day, we use our arms to lift objects, write, eat, work, exercise, and perform countless other tasks. Understanding the anatomy of the arm helps us appreciate how different structures work together to create smooth, coordinated movement. The human arm is made up of bones, muscles, joints, blood vessels, nerves, tendons, and ligaments. Each of these structures has a unique role in maintaining strength, flexibility, and function. Let's begin with the skeletal framework. The upper arm contains a single long bone called the humerus. It is the largest bone of the upper limb and connects the shoulder to the elbow. The top of the humerus forms a ball that fits into the shoulder socket, allowing the shoulder to move freely in multiple directions. At the lower end, the humerus joins with the bones of the forearm to create the elbow joint. The forearm contains two long bones, the radius and the ulna. The radius is located on the thumb side of the forearm, while the ulna is located on the little finger side. These two bones work together to allow the hand to rotate, making movements such as turning a doorknob or using a screwdriver possible. The elbow is a hinge joint that connects the humerus with the radius and ulna. It allows the arm to bend and straighten smoothly. Strong ligaments stabilize the elbow and keep the bones properly aligned during movement. Now let's explore the muscles of the arm. The most well-known muscle is the biceps brachii, located at the front of the upper arm. This muscle has two heads, which is why it is called the biceps. Its main function is to bend the elbow and rotate the forearm so the palm faces upward. The biceps also assist in lifting and pulling movements. On the back of the upper arm is the triceps brachii. As its name suggests, this muscle has three heads. The triceps straighten the elbow and are responsible for pushing movements, such as pushing open a heavy door or performing push-ups. Another important muscle is the brachialis, located beneath the biceps. Although it is less visible, it is one of the strongest muscles involved in elbow flexion. The brachioradialis is found in the forearm and helps flex the elbow, especially when the hand is in a neutral position, like during a handshake. The forearm contains many smaller muscles responsible for wrist and finger movements. These muscles are divided into flexor muscles on the front of the forearm and extensor muscles on the back. Flexor muscles bend the wrist and fingers, while extensor muscles straighten them. These muscles connect to bones through strong connective tissues called tendons. Tendons transmit the force generated by muscles to produce movement. Healthy tendons are essential for smooth and efficient motion. Now let's discuss the blood vessels that supply the arm. Oxygen-rich blood reaches the arm through the brachial artery. This major artery begins near the shoulder and travels down the upper arm. Near the elbow, it divides into the radial artery and the ulnar artery. The radial artery runs along the thumb side of the forearm and is commonly used to measure the pulse at the wrist. The ulnar artery travels along the little finger side and supplies blood to the forearm and hand. Veins return oxygen poor blood back to the heart. Important superficial veins include the cephalic vein, basilic vein, and median cubital vein. The median cubital vein is frequently used for drawing blood and inserting intravenous lines because it is easily accessible. Now let's examine the nerves of the arm. The arm receives its nerve supply from the brachial plexus, a network of nerves originating from the spinal cord in the neck. These nerves control muscle movement and provide sensation to the skin. The median nerve travels through the arm and forearm into the hand. It controls many muscles responsible for thumb movement and finger flexion. Compression of this nerve at the wrist leads to carpal tunnel syndrome, a common condition causing pain, numbness, and tingling. The ulnar nerve passes behind the elbow, creating the familiar, funny bone sensation when struck. It supplies muscles of the hand and provides sensation to the little finger and part of the ring finger. The radial nerve travels along the back of the arm and controls muscles responsible for extending the wrist and fingers. Injury to this nerve may result in wrist drop, making it difficult to lift the hand upward. The musculocutaneous nerve mainly supplies the muscles in the front of the upper arm, including the biceps and brachialis. Now let's look at the shoulder joint. The shoulder is one of the most mobile joints in the body. It allows the arm to move forward, backward, sideways, rotate inward, and rotate outward. This remarkable range of motion is possible because of the shallow ball and socket joint formed by the humerus and the shoulder blade. Several muscles known as the rotator cuff stabilize the shoulder and keep the humerus securely positioned during movement. These muscles work continuously whenever the arm is raised or rotated. The wrist connects the forearm to the hand. Multiple small bones and ligaments allow complex movements, including flexion, extension, side-to-side movement, and rotation. These coordinated actions make activities such as writing, typing, drawing, and gripping objects possible. The muscles, bones, blood vessels, nerves, tendons, and ligaments all work together as one integrated system. When you lift a cup, your brain sends signals through nerves to activate muscles. Muscles contract, tendons pull on bones, joints guide movement, arteries deliver oxygen and nutrients, and veins carry waste products away. Every movement depends on the perfect coordination of these structures. Keeping the arms healthy requires regular exercise, proper posture, stretching, balanced nutrition, and avoiding repetitive strain injuries. Strength training improves muscle function, while flexibility exercises help maintain joint mobility. Adequate calcium, vitamin D, and protein support healthy bones and muscles. Understanding arm anatomy is valuable not only for medical students and healthcare professionals but also for athletes, fitness enthusiasts, artists, and anyone interested in the amazing design of the human body. Thank you for watching this complete guide to arm anatomy. If you found this explanation helpful, be sure to explore more anatomy topics to continue learning about the incredible systems that make the human body function every single day.